Thalamus, like all gall, is divided into three parts. And we can look at the thalamus in two different planes, conveniently. The coronal plane, which we've looked at briefly before, with the epithalamus, thalamus, hypothalamus, and the floor of the third ventricle. The rest of the thalamus is around like so, and the hypothalamus on the floor, and the roof plane. And across the other epithalamus, thalamus, hypothalamus, and so on. So we have the third ventricle here, with its derivatives, epithalamus, thalamus, hypothalamus. We can divide the thalamus into three parts by an internal medullary lamina, which splits at the top. And halfway down to form a medial and lateral and intralaminar complex. In that intralaminar complex, we have the anterior nucleus and the center median. If we look at this in a horizontal plane, we have something like this with the third ventricle, the back end, the third ventricle, the back end, the medial, the intralaminar, that's the anterior, center median, and the lateral complex. Now the lateral complex we're going to divide in half with a dorsal lateral and a ventral lateral. Put that in quotation marks, and this is a regional diagnosis for the moment. And then this view in the horizontal plane is going to depend on whether I cut the section at that level or this level. If I cut it dorsally, we'll just have a lateral complex that fills in the whole top. It has a lot of subdivisions, but they're essentially irrelevant because it's essentially going to be a two-way connection to cortex. Frontal, central, parietal, occipital, and so on. It's this ventrolateral, it's the ventral part of the lateral complex that becomes the key to the thalamus. Because it is divided in relation to the center median nucleus into a VA, anterior, a VL, lateral to it, and a VP, posterior to it. And then we have, these will become important because they're going to be the major relay nuclei of thalamus for one system or another. And then to make that 3 become 6, we can divide VP, the VPL, VPM, and throw in the two geniculate, medial and lateral. So now we have 6 pair of 3s for the ventrolateral complex. So any problems in this quick division of the thalamus? It is, as you may see, centered. It's a geographic nomenclature with the center median essentially at its center. Here we have anterior and posterior and medial and lateral dorsal and ventral, and the most interesting and somewhat most complicated is the lateral ventral complex. Anterior and lateral and posterior center median, and then the two geniculars. Let me just catch that from the sequence. The thalamus is going to be the way into the cerebral cortex, with the exception of the olfactory system, which has its own cortex, being a telencephalic derivative to start with. Everything else that gets into the cortex is going to go through the thalamus. And so the thalamus then is our key to the cortex. The thalamus is going to receive essentially everything from below. So it's going to be from the afferent side of the thalamus. It's going to require a review of the whole rest of the nervous system we talked about so far. So it's a nice central piece of brain sitting at the top end of the brain stem, receiving from every system we've talked about before, and passing on to all the cortex that we come to. So any problems with this general scheme of things? You see the medial lateral, anterior posterior, you see the center median, which is a rather small nucleus in relation to the whole thalamus, but it serves as a focal point for the whole nomenclature. Well, let's tackle these one by one. The medial thalamus is in two-way connections with hypothalamus. The hypothalamus that was, as we saw last week, is the front end of the reticular formation, and so it's receiving from below and projecting down. And this turns out to be one of the most primitive polysynaptic systems that we have. It receives from, among other things, the collaterals from the somatosensory systems, specifically say pain, which are coming up on the other side, giving collaterals into the reticular formation, and collaterals into the supracolliculus, through the third layer of the white matter of the supracolliculus, and is really on its way up, really in quotation marks, as spinothalamic tract say, really on its way up into BP. We're giving all these collaterals that will make up most of the system. And so we have projections from supracolliculus, hypothalamus, reticular formation, the hypothalamus, in the medial thalamus, and from medial thalamus, hard to draw in that plane, we can draw it this way, we have the two-way connection to the frontal pole. this now is the so-called extralemniscal pathway, which conveys not so much the quality of sensation, not so much the intensity of sensation or threshold, but conveys an emotional content to the sensation. It is the system that is affected most in the old days by frontal lobotomy or taking off frontal polar cortex or destroying medial thalamic nucleus. These have all been sites that have been destroyed. For the relief of the emotional fear of pain, chronic pain, cancer pain in particular, and this is a very effective treatment for that. One of the interesting components of this related to the level at which one transects, say, the spinothalamic tract in relation to the supraequiliculus. If you transect it low before the spinotectal component was given off, it was effective. If you did it high, after that spinotectal component was given off, it was not effective. Because although you raise the threshold for pain by transecting the spinothalamic tract, and we'll see when we get to BP, same principle, one can raise the threshold. But once you get sensation above that threshold, it becomes very threatening and emotion-laden, and the extralemniscal system through hypothalamus, mesothalamus, frontal pole takes over. Any problems?
What part of the frontal pole is good?
Well, it's essentially all of the frontal pole. They have numbers which I forget at the moment. Must be 8, 9,
6, 8,
so on.
6, 8 pairs.
Yeah, it's in front of 6. 4 and 6, and then you get 8, 9, and so on. The next system to consider briefly will be the anterior thalamus. Anterior thalamus is the major relay for the limbic system. So we'll have this anterior nucleus projecting into cingulate gyrus, around the cingulate gyrus, the cingulum, and so on, eventually getting down to hippocampus and the fornix, and the mammillary body here is part of the hypothalamus, projecting up into anterior thalamus through the internal medullary lemma and contributing to the myelination of that system. So the mammillothalamic tract and the anterior projection to cingulate gyrus will become part of the limbic lobe system, which we'll talk about in more detail when we get into cortex. median, I'm going to delay until we get to the rest of the basal ganglia, as I will delay for BA. So those two, I promise you, we'll get back to. The dorsal lateral part is in two-way connection with all the rest of the cortex. Erase these names for a moment and come up into the dorsal lateral complex. And you have frontal, central, parietal. Pulvinar back here is going to be occipital, temporal. And so you have sort of a regular two-way series of connections between cortex and thalamus involving the dorsal part of the lateral complex. So relatively quickly, we've come down to talk about the major relay systems in the ventral half of the lateral third of the thalamus, which I've illustrated here in this horizontal section. So many problems about this rather quick summary of all the other thalamic nuclei. Medial, lateral, interlaminar, three major divisions. Two divisions of the lateral, dorsal and ventral. Six divisions of the ventral lateral complex. Anterior, lateral, and posterior, related to center median as the focal point, and the two geniculus. So we have six of these ventrolateral nuclei to focus our attentions on. And as I hinted, more than said, these are going to require a review of the whole rest of the nervous system. VA and CM I'm going to postpone to the basal ganglia, get the rest of those in position. VL. VL is going to receive from the red nucleus and from the opposite dentate nucleus either directly or indirectly, and this intermediate nuclei also. So this becomes a major cerebellar input, the VL. And a major projection out to areas 4 and 6, motor and premotor cortex. For stages 2 and 3 of the cerebellum. So, Peter, do you have any problems on reviewing in your mind the 3 stages of the cerebellum? We can leave out stage 1 because that's going to be vestibular and not involved in the system. All the rest of the cerebellum. Stages 2 and 3. The simplest of these is going to be stage 3, involving all the cortex, projection down to the pons, crossing over to cerebellar cortex in middle cerebellopedoncle, ending features, what kind of fibers? Mossy fibers, right. Onto granule cell dendrites, granule cell axons up into the molecular layer, running through the dendrites of the Purkinje cells. Purkinje cells back down onto dentate nucleus for the lateral cerebellar cortex. Going out through the superior cerebellar peduncle, to the opposite red nucleus and thalamus, known up to a particular part of cortex. At least we've made a great big oblique circuit, cortical, conto, cerebellar, thalamus, cortical. So pathus, the cerebellum, pathus in the forebrain. Allowing the lateral cerebellum to influence the movements that we're going to see eventually coming from motor cortex. But of course, the pontine nuclei project to other parts of the cerebellum, not just lateral. They'll project to the paravermian cortex. Those mossy fibers, granule cells, Purkinje cells, Purkinje cell axons inhibit the stage 2 intermediate nuclei, lobos and ball point. Follow the same path to the superior peduncle to red nucleus, on up this way, but also back down through cerebrospinal tract. So we begin to pick up the second stage afference to the cerebellum from other parts of the nervous system than the cortex. And Ray, what would those other afferents to paravermian cortex include? Stage 2.
Does that include something in the vestibular nucleus?
No. No, vestibular is going to be stage 1. Stage 2 is going to be spinal trigeminal. Stage 3, cortical, forebrain.
Okay, so some of the other afferents.
So some of the other afferents from what kind of nuclei of spinal trigeminal segments? Is a broad one-word answer. Clark. Clark's going to be one of them. Association nuclei. So we're going to get into paravermian cortex related to spinal trigeminal systems from association plate nuclei. And the association plate nuclei of spinal segments are going to be Clark's nucleus, for one, and another one.
The equivalent of the trigeminal.
We have Clark's nucleus to give rise to the dorsal spinocerebellar tract. So we ought to have a nucleus to give rise to ventral spinocerebellar tract. Which is going to be more diffusely oriented or organized in the base of the posterior horns. And Noel, from the brainstem segments? Well, let's see. Isn't that difficult? Because we know, when we go back to the spinal segments, we know we have muscle spindles coming into the Clark's nucleus, and everything else coming into the other one. And so, get up in the brain stem, and the major muscle spindle system in brain stem is nucleus. David, you're looking down as though you wanted me to ask a question.
Actually, I was trying to find the answer to a question about it 2 ago.
Jonathan, major spindle system for brainstem segments. David, behind the camera.
I want to say they're like the mesencephalic.
Mesencephalic trigeminal, right. It's that odd little structure sitting up in the midbrain. Primary sensory neurons, with one exception to having all of it, everything else out in the ganglia, and presumably mixed in there, or somehow associated with the nucleus and suprasegmental component, or association plate component of that, because you're going to take the postsynaptic spindle input, throw it into the cerebellum, along with the spinal. We know that nuclei, the association with nuclei for the spinal segment, that it's going to receive from the opposite side of the body, trigeminal and spinal, inputs for everything except the spindle. We got the spindle system taken care of in the cerebellum. And VF. Now we have to pick up all the others. Which only requires remembering then the association plates for each of the spinal brainstem segments, for each of the small and medium-sized fibers. And so if we take the small fiber system first, which will give rise eventually to spinothalamic tract, which is going to cross, descend, giving rise to these collaterals to reticular formation, colliculus, on its way up into ventralis posterior. And so the nucleus that does that, Ray, is what?
Nucleus proprius?
Right. Nucleus proprius. And it receives from what, Ray?
Well, it comes in the Sower's tract and the marginal to the gelatinosa.
So we've got gelatinosa and marginalis as the 3 layers of the complex polysynaptic nucleus, and the small fibers themselves are coming into Lissauer's tract, giving rise to secondary collaterals from Lissauer's tract into this laminated nucleus, and eventually projecting up to thalamus as spinolateral, spinothalamic tract. And for the face, the small fiber system for the face, Noel? Petra? Exactly comparable. Small fibers from the face, trigeminal, come in, branch, but it's the caudal branch that comes down in the spinal tract of the trigeminal, gives rise to secondary collaterals into the nucleus of the spinal tract. Same laminated 3 layers of cells. The final output, nucleus proprius of the spinal tract of the trigeminal, gives rise to crossing fibers. Come in and join the spinal thalamic tract fibers. So we have face, arm, and leg. We join the other fibers above coming in. And so we have all of the small fiber system coming through this polysynaptic segmental association plate, crossing as the trigeminal thalamic, the spinal thalamic tracts, up into the thalamus. And oddly enough, going into face, arm, leg areas, medial to lateral.
Is there a little bit of uncrossed input that comes up from the spinal cord as well?
An uncrossed component?
Yeah.
Probably.
If there's a unilateral lead in the thalamus of those areas, you get complete sensation on the opposite half of the body.
At a thalamic level or at a tract level, you get a pretty complete loss of pain temperature on the opposite side of the body.
So if there is some uncrossed, it's not very much.
And it's hard to know how much of what's preserved would be uncrossed or through reticular and collicular collaterals. But at least as a first approximation, it's crossed. And now we come to the medium-sized fiber system. What's the major spinal associated plate nucleus for the medium-sized fiber system?
Two different dorsal column nuclei.
Right. Nuclei, those are columns.
Bacillus and cannula.
Vastus cuneatus. Give rise to crossing fibers and come up medially as the medial meniscus. So we have arm and leg come up here. And face coming in. Well, how are you in the nucleus of the trigeminal that does that? David? Main sensory nucleus of the trigeminal. So we have the 3 major regions, face, arm, and leg, medium-sized fibers, coming in from main sensory, vastus cuneatus, crossing on their way to the thalamus, giving rise to collaterals, reticular formation, supracolliculus. So we have 2 separate tracts, medially and laterally placed in the brain stem, for 2 separate kinds of fibers. 2 separate kinds of sensory inputs that become recombined in VP by place. face, arm, and leg.
So is there really, I mean, it starts to seem to me like there's not a really good reason to divide this into a VPL and a VPM. It seems like this should be the VP.
Why do we do that? In the horizontal plane, what we see is, in a mile of sheath state, we see a pattern that looks something like this. So we have an internal component that's sort of laminated off from the lateral component, which is how the name began. And so VPM and VPL are fairly sharply delimited from each other.
But is there any, what are those, is there something running through that tract, or is that like split it halfway down the arm, so half of the arm fiber's going to VPM and half
No,
to
no,
VPL?
it's face. VPM is essentially face.
Oh, okay.
Arm and leg are lateral.
Okay.
I tried to do that. Take a look here.
Sorry, wasn't watching your daughter.
Any other problems? So far we have the three sizes of fibers in the sensory plate of each of the spinal brainstem segments. Small, spinothalamic, trigeminothalamic, medium, medial meniscus, midothalamic, and large, coming in through stage 2 of cerebellum and going out VL. Between VP and VL, we have quickly summarized all of the association plate elements of all of the spinal segments, brainstem segments, with the exception of special sensory components. These are all sort of general types of inputs. I think we did the whole nervous system in half an hour. So it's a pretty quick review.
Did you mention the cortex as to where these are going?
Oh, thank you. Thank you for that. Come out to sensory cortex, areas 3, 1, and 2. So we have the central sulcus between sensory and motor cortex.
The same arrangement is kept.
And face, arm, and leg represented on the cortex, right. So you're going to have the central sulcus.
You said quintothalamic, is that what the main sensory nucleus is?
Oh, yeah, it's
trivial, but
it's just to distinguish the pain temperature system trigeminothalamic from the other relatively small component from the main sensory nucleus.
And does anybody know how you mentioned it, but the mesencephalic spindle fiber system into cerebellum, does anybody know if that's superior cerebellum,
No,
peduncle, or inferior?
We don't honestly know beyond the facts that embryologically cells in the region of the mesencephalic peduncle project their axons back into superior cerebellum. We don't know that those are the ones that persist as the association pedalamus. Houseman just assumed that they did. I don't know if anyone has really shown that they received the heavy synaptic connections, comparable flux. But they ought to. They just get lost, I think, in the overwhelming development of everything else. Well, that leaves us with the two geniculus, auditory and visual. The auditory system is pretty straightforward, having considered that back at the inferior colliculus. What kind of colors have I got here? The inferior colliculus, which is going to be a slightly better color. I have a better color now through the used here. I'll get a purple color. Wait a minute, that's bright purple. Thanks. The inferior colliculus, giving rise to fibers sweep out to the medial geniculate through what tract, Mike?
Breaking of the inferior.
Breaking of the inferior colliculus, right? And containing not only collicular tectogeniculate fibers, but also fibers from the nuclei of the lateral meniscus, the rostral one and the caudal one, which are going to give collaterals into inferior colliculus, called the lateral meniscus. The superior olive, trapezoid body, are going to give rise to the same kind of systems. And the one system that is not going to bypass the inferior colliculus is going to be over here from the cochlear nucleus, which gives rise to the beginning of the bilateral auditory system, lateral meniscus. The inferior colliculus. It's the only one of this system that is going to stop at inferior colliculus. All the others are going to stop to give a collateral onto medial geniculus through this breaking. So one can destroy the inferior colliculus and not seriously interfere with hearing. At least bypassing.
Is hearing affected, or does it seem to just not even mind?
Oh, yeah, I don't know quantitatively. It's not going to interfere with most of the reflexes that one can study on auditory system. It's a very rare lesion in the human. That must be studied in the human. But it's the collaterals of lateral meniscus into reticular formation, the collaterals of medial geniculate that allow for intersegmental reflexes and conditioned reflexes to sound to persist following a major collicular lesion. But incomplete in the sense that it didn't destroy the breakdown. And medial geniculate, of course, is then going to project off into the temporal lobe, 41, the auditory cortex. So now we have only one left, visual system. Not sure I can do the visual system in 5 minutes, but at least schematically we can. By showing the optic nerves and chiasm tracts. So we have the chiasm crossing fibers, lateral fibers, the chiasm, nerve tract, coming from the third layer of cells, the ganglion cell layer of the retina, projecting back to the lateral geniculate, ending in almost alternate layers of the 6-layered geniculate, and then projecting on to the occipital cortex, area 17, through the visual radiation, some of the fibers taking a little detour, a temporal detour, Meyer and Archambault. Forming a big, broad band of fibers, beginning in a relatively small lateral geniculate, and spreading out into temporal and parietal white matter, coming back into the visual cortex on the medial surface of the occipital lobe. And so I will leave you at this point to figure out in your mind's eye, imagination, how we get from a diencephalic structure near the third ventricle, of origin from the third ventricle, lateral to the lateral ventricle, diencephalic ventricle. These fibers are lateral. They end up medial. Now I phrase the problem in as complicated a way as I can to challenge you to see if you can figure out how this happens in 3 dimensions. Begins medial, sweeps laterally, ends up medial. There was another little piece that until I made the model, it was impossible, I thought, to see. So we'll see if it's possible for you to see without having made the model. Because it's not that difficult. But it does require looking at a couple of pictures and trying to put them together.
Could you sketch in the internal capsule?
Yeah, the internal capsule is lateral to the thalamus. Lateral to the thalamus.
So it separates the geniculus from the thalamus?
Well, it pushes the geniculate behind. You smile and nod as though that was clear, but they are pushed, well, they migrate laterally and are pushed posteriorly by the internal capsule through the penile. So they never really lose their connection to the thalamus. But they are distorted. But grossly, when you look for them, you'll find them touching each other at the back end of the cerebellum. And I wouldn't want to give away all of the trade secrets about the internal capsule in that very brief answer, because that's going to be the major point of departure next.